The other thing you made mention of, actually, you made mention of a couple things. I was making notes here, but one of the most recent things you said, is the switch to competency based, basically everything, right?
Yes.
And initially, I'll use my own view here as an example. It was a hard pill for me to swallow. First of all, it was, I accepted it because I know it's going to change, but internally, I'm just like, we've always done it this way. Why do we have to change from the isolated things and then kind of putting it all together as you go, and then okay, you're good, right? Worked for me. I got here, right? Why can't it work for everybody else? And then there's switch to competency-based stuff. And the funny part is as I've thought about that, I have gone back to early in my career. There's more than one way to do things, right? And we need to actually, maybe I'll stretch this a little further than I wanted to, and go into the discussion of some of the older medics versus what we're getting taught now. But we have this problem where I had to learn registry
I know
to get to the end of paramedic school. I learned what registry wanted. I applied what registry wanted. I got my ticket, and then I went out and did field medicine.
And it was
the way that
cause and effect medicine,
correct.
Not clinical competency.
It wasn't clinical competency, right? Yeah. And that journey to be a clinician.
Now you have to understand pathophysiology.
To have clinical reasoning, right?
Yes.
And that's a great point, right? My pathophysiology, I think, was 2 days, if that. In school,
it's
right?
The EMT
it was
class.
part of paramedic, but it was part of my paramedic class, right? And he's like, bones, cells, things. Okay, you're good.
Let's start paramedic.
First drug for cardiac arrest is this. Then you do this. Then you do this. There wasn't any reasoning. There wasn't any why behind why we were doing things, and that I'm very happy. Right.
All memorization.
It was.
I
It was
would
raw
love
memorization.
to say that we don't. I think at one time, never part of my teaching career, but I think that at one time we were teaching medics to pass registry.
100%.
We were teaching to pass a test.
100%.
I still, to this day, and I'll stand on this mountain, I teach certain parts that if you learn this, you're going to pass this question to registry, and that might be the GCS score.
Passing registry is more, you have to have good study habits, you have to have good test-taking techniques, you have to have good clinical reasoning is a component of registry now. It's not just, it's clinical judgment is a section on the National Registry. So it's not anymore, you have to memorize med math. Med math was huge. How many drips would you have to figure out?
You're not doing that anymore.
You're not doing that anymore. But if you're just memorizing and you're not understanding, you're not going to pass National Registry because you're going to have a hard time
all
with
of
it.
our students, they roll their eyes because anymore it's like I make them, we run through a scenario and then it's like, all right, in the debrief, why?
Right.
What do you mean why?
Yes.
How did
why
you
did
get
you
there?
come to
Why
this?
did you get to this? And then what other pathways could you have What if that had failed? What if you didn't have that drug? That drug was on shortage. What's a drug in the same class? We'll talk about all those things here in a minute. But it's that clinical reasoning.
But
it's that competency-based stuff.
We're teaching now differential diagnoses, and we weren't
100%.
Yes. Like what led you to this, and what's the day 3? I think I start telling them, all right, when we talk about something that's an illness, I want you to give me 5 things that'll kill the patient first, and this can be one of them, but I want 4 others. And then we work the path. This is how we get to here from there.
Well, and
I call it the funnel.
Yeah.
Right?
Yeah.
I call it the funnel.
That's what it is. Differential
said,
diagnosis.
Let's say your patient has altered mental status.
What
could
right?
be
Give
all
me
of these things.
Yes.
Come on,
and then you start to then you start to funnel it, right? But
that's more
to your
than
point,
5.
To your point as well, it's like you are teaching them clinical competency. And with that comes critical thinking skills to be able to pass the test, because when they say the question is, you have a patient with an altered mental status, you have to start to narrow down through your clinical judgment, right? So as you teach them as educators in that classroom to start to follow an algorithm of, I'm eliminating things. I got a blood sugar. I got this. I got that. I did a stroke scale. Okay, stroke's out. BGL's out. Okay, so I am starting to funnel down. You're teaching them an algorithm to start to move down in that. Whereas in the past, it was just, well, this is it. It has to be one of these 3 things. But what happens when in the past versus now with clinical competency-based training is in the old school way was, well, I got to the end of the road and I got to the stop sign and I don't have anything.
Yeah.
So what do I do?
Yeah.
And now it's like you can pivot, you can continue to critically think to try to
it's no
solve
longer
that problem.
You can't any longer teach the student that there's two answers that are correct and two that are wrong. One of them is going to be blatantly wrong. One of them is going to be really wrong. One of them is going to be close, but one of them is going to be it.
Well,
you can't really say that.
Here's what I tell students. You have to both look at the questions you get right and you have to look at the questions you get wrong. If you can't explain to me why you answered a question correctly, then you don't know it.
And you don't know it.
And
right?
then and you're going to have problems because of the application-based learning. So you have to be able to look at that and say, well, why wouldn't I have chose A, B, or D, right? And even in the changes that we'll get to with registry, having that kind of mindset is going to help you with whatever style question you have. Because if you can give that explanation, and you're right, it's not, you should be able to remove two, but that doesn't mean those two answers were wrong to the application of the patient. It's order of importance.
Yes.
But I think that you have to sit back and you have to remember that there's a flow to every patient, and if you remember pathologically and chemically how they got there, you can work it out. And I think that's very important, and it's very important.
Yeah. The other thing that you actually touched on earlier, is mentorship and mentors. So I kind of by default, I didn't get assigned a mentor. I didn't choose a mentor as part of my paramedic training. I had a guy I latched on to because I'm like, this dude's super smart. I like him, right? And, he can speak my language. And now more of a required thing, right? And I want to talk. We'll change this tune a little bit. We've kind of been overview-ish from the admin side of things. Let's kind of start looking through the optics of the student. What should the student think about when choosing a mentor? And secondarily, and this is you're over there like, and I know I'm internally going because I don't think enough time or consideration is spent with that. It's like, ooh, I like that guy.
I'm going to pick him. He'll sign my paper.
He'll sign
and
my
leave me alone.
papers.
Or
yes.
what I'm seeing a lot of time is it's somebody from last year's class,
Yep.
and they just pick them because they just went through it.
Yep.
And
It's really that concept and that idea is really meant to be somebody that's going to challenge you and it's going to push you. You got to think of that as a parent, right? I didn't like what my parents told me 90% of the time, and you shouldn't like what your mentor tells you 90% of the time.
Correct.
But they're meant to push you and get through the program. Unfortunately, some of what we see is you'll just sign my paper and you'll leave me alone. Well, when something starts to go awry in the program, what we go to is your mentor.
Correct.
We're like,
Yes.
hey,
why
the
isn't your
student's
boy
struggling.
performing?
Can
Yeah.
you help them?
Or
And they're
your
like,
girl.
oh, I had no idea they didn't call
Without
me.
exaggeration, I think I can tell you that once at least a week, I'm on the phone with one of the students' mentors,
Sure.
or we're texting.
Yes.
Yeah.
And like you said, it's absolutely a go-to.
Yeah.
What are
Hey,
they doing?
so and
How
so's
they doing?
not doing great on this. They need help. And average mentors will get back to you and be like, well, I'm going to work on this. I will have some, especially the ones that they always pick from the last year class, that are kind of like, okay. I say, well, that's more than okay. We got to work on this, So
I think it's an
That's
important
part of the-
relationship. I think it's an important
It is.
relationship.
Yeah.
You need to pick someone that is. I've been a mentor a couple times for students, and it takes effort on both sides.
100%.
So I think if you're going to be a mentor, you can't just sign the paper and say this is bogus.
you're
like,
making a
yeah,
commitment.
I'll answer the emails and some phone calls, whatever. Thanks. No, you're making a commitment to that student, and the student needs to feel comfortable enough to call and say, hey, I'm struggling with this. I need your assistance.
Yeah.
And you have to put in your time to help them. That's what you signed up to do. And this isn't a new concept. Look at what the fire service is doing. It's EMS service and fire service, and a lot of times those are combined.
Yeah.
But we're doing the same thing in the fire service when we hire a new employee. You want to assign them a formal mentor so that they have that person to go to. They can explain the why.
Absolutely.
They can help with that. And I think that is a huge portion of our success in this program is the mentorship thing.
Yeah.
I know when I mentored a couple, and I communicated at least probably once a week, if not more, with the student that I was mentoring, and I talked to one of the instructors, and he was struggling on a couple things, and that's okay. He was very honest with it. I need help on this. And we all know someone, to your point, right? So I can teach certain subjects, in my opinion, very well. There's other ones that I can't teach very well. I could teach mediocre. Okay, it's just not my strong suit.
No.
But I know somebody that I can get you with. And a lot of times me helping him was, okay, I set up this time. You're going to meet him at this place or go to this fire station for this many hours, and they'll help you with cardiology
XYZ,
or whatever it is,
yeah.
XYZ.
That's awesome.
But that's what you want to do to the student. So you are invested in that student and their success. So it's not just
a name on a piece of paper.
correct. It's not just that. You know,
Now,
you have to participate in that.
I also think on the flip side, we have seen the other extreme where it becomes punitive. Now, that is also not supposed to be a punitive relationship, right? So if you're picking a mentor that's somebody that you work with or is your fire chief or whatever, that's not to say that that can't
happen,
work,
right.
but you need to be
careful
very
about who you're
cognizant
Sure.
Yes.
of how, and I think that relies more on the mentor. The mentor's the one that needs to have that ability to understand, you know,
Set the
this
tone.
is also my subordinate, and so I need to differentiate this church and state,
Yeah.
you know, and I have to be able to help guide them, and it's parental, you know, I have to guide them through the program, but I can't give them punitive measures for that
Correct.
either, and we've seen that happen, and that doesn't work either.
No.
I think, what was it, 4 or 5 years ago, we had to meet somebody at a hospital system to go over some issues. And I was surprised that they were surprised when first their mentor showed up. And then second, when the mentor knew everything
That
already,
was
'cause
going
they're
on.
like, how'd you know all that? It was
But
like,
then
"You
also
don't
the mentor
understand
wasn't
talk."
talking to them, so it didn't help either.
It didn't help either. So I guess the point being is exactly that. Like, when you pick a mentor, first of all, it should be your pick. You shouldn't be forced to have a mentor
Correct.
based on, you know, your department said I'm paying for it. So I don't think that works. It has to be somebody you're comfortable with, but pick somebody who's been doing this, who's wise in this, who will actually stand up for what's right both ways, if you're right or wrong.
Sure.
And hold you accountable. Like,
Yes. But it's going to also deliver the time that you need to it.
Yeah.
It's not just your name on a paper and a phone call or email a couple times throughout a year, let's say a year's time. No, you need to be participative in it. And I think it should also be someone that is, in my personal opinion, given my position now, it should be someone that's riding the ambulance every day.
yeah, I agree with that.
I mean, I just, you know, not that I don't think I'm
Or at
completely
least
out of touch.
routinely, yeah.
I don't think I'm out of touch, but they're routinely, you
At
know,
least routinely, yeah.
they're routinely riding that, right? You know, however many patients I'm going to see compared to how many my crews are going to see. Yeah, I have like
There's
5 or
there's
6
a
names
gap
that
there,
pop
yeah,
into my
sure.
head that like, yeah. You know,
Yeah.
I would want you with this person, this person, this person, because they're seeing the volume, right? It's all about reps, no different than why do we want them to start so many IVs? Why do we want them to do so many med pushes? Why do we want them to do so many assessments? I want you with the person that's doing that volume of that as well.
Yeah.
You know,
Yeah.
not saying that a chief or a battalion chief couldn't do that, but I think you're better suited with somebody else.
No, I agree. I think that
You know, and I'm comfortable in saying that in my position. If somebody came to me and said, "Hey, I want you to be my mentor for paramedic school," I appreciate that. But
I have the
let's
perfect
pick
guy
some-
for you.
yeah,
I would
exactly.
maybe give them 3 or 4 names, or you know, and say maybe you should look at them. I appreciate it, but
Yeah.
I think you'd better be served with them, because I also know I don't have that necessarily that time to dedicate
Yeah.
to
Sure.
them as well.
Yeah.
If there's certain types of things, like if they want to come talk to me about pharmacy and medications and drip rates, you want me to teach you that? Sure, I will. I
But
love
again-
that.
No,
That's
we
great.
can- yeah.
that's
You
where
know.
I would point them to say, hey, you need to talk to Ray or Chris Sanchez about
Yes,
something like this.
yeah,
Because
it's-
these guys, they understand it. They know it. Molly Kogan seems to be good at that type of thing. It's like, I'm not. So I'm going to point you to where you need
Sure.
to go. But again, that's with the mentor. They should have the knowledge and resources in their back pocket to say, I know somebody. And that's really important.
So let's continue on that pathway of the student,
Sure.
right? So we kind of steered off the admin stuff with the mentorship, and let's talk about some common issues that we see somebody coming into paramedic school. Some of those challenges, some of the issues, things that they can do to prepare themselves for paramedic school. And honestly, I think those mostly mindset things, to be quite honest with you, because this day and age, you're coming out of A&P, you're coming out of another structured class before you're entering paramedic school. Not that A&P has its own challenges, but it's different. You're committing the next, and let's just a broad brushstroke.
It's the
next
mindset.
year
I'm doing
of your
this
life.
so I can get to this,
this, right.
but you're not focusing
On that,
necessarily
yeah.
on that. Yeah.
Every year, you're going to have students that can do this without ever opening a book or reading a book, and they're going to get it strictly off of lectures. And I'm telling every student, don't ever be that student. I was that student. I don't think I opened my book.
Oh, I was not that student.
But
I wasn't a student.
I had a really good instructor who makes a lot of medics, and I'll give Ed McCormick that because he's made more medics than I know of a lot of people, and he's been doing this forever. You know, it was at repetition. Maybe he just guessed. I don't know. Good job, Ed. But I was one of those. And every year you're going to have that. But what I'm saying is don't come with that expectation. You need to put in the study effort. You need to put in time. And if you're not good at reading a book or knowing how to use a book and its notes and its highlights, you got to be.
You have to everybody learns differently.
That
right?
is
so I think that's where we're going.
The point
so
I'll
try to stay on track here. Nah.
Well, and the challenge we're seeing is, and it's not new. I really just think it's developing because of the changes in the delivery in the program. But most students, not all, but most coming to a paramedic program are not coming from another post-secondary environment. Okay. Now, we did talk earlier that we're seeing some more of that, but some of those students are also very removed from a post-secondary environment. Sure. And it's a different learning environment. Yeah. I'll take my pre-med students, for example. We do some specific classes just for pre-medical students. And the challenge I always have with those students is in your pre-med classes, it is learn and dump.
It's boxed.
You're learning this, you're dumping it, and you're gonna have to take the MCAT, and some of that's gonna build on itself, right? But this class is all building on itself. You can't cram all this information into Sunday night at midnight and then dump it on Monday when you take the test and then move on.
You need to retain
it's all gonna retain and build. So it's understanding good study habits, but also understanding any bad habits you have. And if you came straight out of high school, or you did it in high school, or you haven't done any post-secondary, or you are the student that goes to an extreme of, I don't open a book, I've just listened to information, then it's not that you can't overcome it, you just need to recognize it. And you need to use your resources. How underutilized are the resources a lot where we get into school and we say, the quintessential, I'm a bad test taker. Okay. Why are you a bad test taker?
Right, because you're not prepared.
Because I am.
Is it time? Is it anxiety? Is it you don't study? Do you not take notes? Do you not take good notes? Do you not know how to read a book?
I've had students who can't read.
Yeah.
Yeah, it's a reading comprehension problem.
Yep.
Yeah.
All right, and it's just
and that's not
learns
a shame
differently.
to them.
No.
I've had students who can't read, and we're shifting. I mean, there's ebooks. They read to you. There's registry makes exceptions. They'll have tests read to you if you need that as an exception. Is that amazing to me? Yeah, because how are you expected to read your protocol? But at the same time, that's now your med director's problem, Dr. Hill. So yeah, that's amazing to me.
Well, I think too, like a lot of your points and what you're all saying here is you have to be honest with yourself, right?
Yeah,
because coming into that class, it's going to be a very diverse group. It doesn't matter if it's EMT, advanced, or paramedic, or a fire class even. You're going to have a very young person, and then you might have somebody that is
40, 50.
Let's say middle age, right? Or so the difference is in study habits, time management. You have to be honest with yourself.
Yep.
We talk about setting the standard in the beginning of the program. I say it too. I just did this, and we're running into a couple problems where you have to read the book, right? I know that I could read the book, and I am going to struggle with that. And then I come to class. I'm an audio learner. Now with some of the electronic books, it'll read it to me right off of the computer, which is very helpful to me. I'm an audio learner. So that's my trigger. I can focus the whole time for long periods of time, retain it a lot better. Yep. But if I read the book and then have to do it, not that great. So you have to be honest with yourself, honest with the instructor, know what works for you, use your resources. There are a lot of ADA options for you if you have dyslexia, if you have a reading comprehension problem, if you are that audio learner that needs somebody to read the test for you. There are things you need to be honest with the instructor about early in the program, on day 1 or 2. And that can be private. That's nothing to be ashamed of.
No, and
those
have
tools are set there to help you.
You and Karen set that all up through the hospital. We have resources now that students can reach out. And it's amazing when they actually do decide to reach out. It's all free.
Yeah.
When they do decide to reach out, some of the help that they've been getting, it's fantastic. I think another thing you have to realize, too, going into this, and I'm not putting it down, but it's not a basic class. So a lot of people come into this, and they're like, well, I can do this. I did that without much work. That wasn't a huge time commitment. I went my 2 days a week or what it be, and I had a few clinical hours. I had a couple squad hours. Well, this is medic school. It's going to be way different, and you're going to be expected to learn a lot of information in a short amount of time.
Even my longest EMT programs are around 20 weeks.
Yeah.
Some to 26, depending on days of the week and hybrid or not hybrid, whatnot. But you're going to paramedic school, you're minimum 9 months, and that doesn't include A&P.
No,
right?
and that's a great point. When A&P was added to us as a prerequisite, I have seen such a phenomenal outcome now of these kids. I say kids, of these students who know a good fundamental background of why the body is doing this, and that is changing everything. It's awesome.
I
remember when I
EMT
first.
Students.
What's that?
Wait till you see my EMT
I can't
students.
wait. when I had a couple this last year, I didn't really think. No, I'm kidding.
I wasn't doing
When
it
I
yet.
first started teaching for you guys, I had to do A&P. I'm not an A&P person. I'm a medic. So when Susie took that over, oh man, it's been great.
Your self-awareness commentary a minute ago, there's also the flip side of that we run into, which is now other people in the class learn differently than I do, and said student might feel insignificant, or might feel like they're not catching on as fast, or somebody are very decisive test takers, right? Mm-hmm. And it's it might be a little demoralizing because I'll use my personal example. I take tests well. I don't even know if I know the information, but I take tests well because I know what the question's asking, right? Mm-hmm. I've learned that. I've learned the science of that. I don't know if that's good or bad, but that's that's it. I take tests really well, so I can fire through some. And for somebody that learns and applies and comprehends differently, that doesn't mean we're going to be bad providers, or I'm going to be a better provider, or you're going to be less of a that there's no correlation there.
Right.
Those things don't line up.
Correct.
And we've had that. I know I certainly have had students that have been I feel bad. I'm always the last one taking the test. And
don't feel bad.
So
did
it's
you?
always going to be the last one.
Did you? Somebody has to
Yeah.
be the last one.
Yeah.
But that doesn't make you better or worse, right?
Yeah.
That's just. You need to process the information the way you need to process it.
Well, and some of that, a big part is the psychology of the program. I mean, we talk about the study techniques and the test taking techniques, but I mentioned the test anxiety thing, right? But know the psychology of the program. Know what your coming and your weaknesses are. Are you struggling with the concept that 16 people have told you cardiology is the worst part of the program, right?
Sure.
And you have to understand that. You have to be able to recognize that, and you have to be able to figure out how to overcome it. Same thing with test taking. I'm sitting there and I know it bothers me that I'm the last one that finishes the test. Well, now let's talk about how we stop focusing on that, right?
Yeah.
Or I'm worried about the time clock in the center. Registry now lets you take the questions away so you don't see how many are left, right? So knowing some of those triggers and understanding how you can remove or you can shift some of that, or you can learn how to deal with some of it, because some of it we can't take away,
Sure.
It's not just about the education.
Well, yeah, too, like to your point, like I hate that, right? So I'm just going to be honest. I hate when it's like you answered question 1, it's like
You see it right there.
I have 110 or I have 109 more to go. That would drive me nuts, right? So I don't look at the number, just focus on the question. And then we teach that, because it's just not that it gives me anxiety, but it's like I just absolutely I hate it. I hate staring at that thing, but I know that's one of the things, so I have to look at it and I talk about it, then focus on one question at a time. It doesn't matter if you're the last one done. We just had this conversation in one of our classes where, well, how much time do I have? This much time. And to your point, maybe if I am the last student that I take, if the test is 3 hours, then I might take 2 hours and 59 minutes to do the test.
Did you pass the test?
Did you pass the test?
Did you do the test, right?
And then a lot of times you'll see that same student go out and they are like on it, hands-on skills. They're fast.
Oh,
There's
yeah.
no delay. It doesn't matter that it takes you
No.
this much longer than somebody else. It doesn't mean you're any different. But I think a lot of this too kind of circles back to time management and planning.
Mm-hmm.
Compared EMT school, to your point, I don't have a lot of clinical hours. I don't have a lot of hospital time. Well, ride time on an ambulance site or clinical hours in the hospital. And you're starting to learn to study again, depending on your age. How far have you been out of school, and have you done any post-secondary? Paramedic school, there is a lot more planning for a longer period of time. Let's just be fair, at 10 to 12 months, depending on where your program's at, what your state is. It could be a year. So that takes a lot of effort for you to be able to plan, whether you have to study, read, prep for a test. Now I have to do hospital time, so much hospital time. I have to
Go do the
so
thing,
much
go do the
ambulance time.
thing, go do the thing.
Plus, you have
yeah.
to have a life, right? You have to have, maybe
Yeah.
you're married, maybe
You
you
probably
have
have
kids,
kids or
you have a full-time
job or-
job, stuff like that. So this requires a lot of planning on your part, and I think we do a really good job of bringing that up in the beginning of all of the programs, and it's not just something we say. And some people need help with that. And
They
then
do.
once they
And every year, we're going to have somebody who either has a baby or gets married or has a new boyfriend,
or
girlfriend.
gets divorced,
And
or
it's like,
something.
we warned you.
Yeah.
We
Life
warned
happens.
you.
It's
Life
going to happen
happens.
as you go through the program, but you have to figure out how
Yeah.
to march on. And likewise, you also have to figure out what's your go, no-go point, right?
Yeah, yeah.
Because there are some situations where you just have to stop,
Back out,
right?
yeah.
Excuse me.
And then you have to be good about being a communicator. We have to communicate in the field. First of all, we have to talk to patients. If you don't want to talk to people you don't know, it's probably not for you. And then B, you have to communicate with
Other
your
providers, yeah.
instructors. Yeah, most of the time, everybody's very reasonable individuals. We've all gone through it. We've all seen the stuff that happens in and out of a paramedic program and have that conversation. That doesn't mean it's not for you anymore. That just means maybe right now it's not the right time. But knowing where you should push through and where is time to set yourself up for success, I think is valuable too.
Yeah. And I mean, when I did it the second time, there was a few years in between there. I had 3 jobs and I was going through a divorce. Like, you can do this.
Yeah.
You can do this. Like, I was working every day on top of clinical hours, on top of class. And it's like, I did it. And I have students that'll come and be like, oh, I don't know if I can do this. I got a full-time job. It's like, I had 3.
Yeah. Well,
you can
and
do this, I promise.
I will say more and more it's come to the fact, like I worked full time when I went through too. I will say more and more the demand of the program, depending on where you're going and how long a program you're going through, and you have to take all that into consideration. The demand of the program has made it much more challenging.
Not impossible, but
not
challenge-
impossible,
yeah.
but very challenging. You have to be very strategic about your time management
Yep,
and your planning,
100%.
specifically with clinicals.
Yeah.
But one of the biggest issues I see with that is most students don't also use their clinical time appropriately either. And that's one of the biggest time management things you can utilize. You're spending as much, if not more, time at a clinical site than you are in the classroom, right?
You can be spending that time studying.
Yeah,
and
when
doing
you're in the
tests
classroom, you're getting lectures, you're taking a test, you're doing something. There's very little downtime that's associated. And if you pay attention to your clinical time in the same manner, and when you're not on a call, now, yeah, you're going to have to structure that a little bit because you can't get super in depth to something and then you get a call and be like, I can't go on the call because I'm in paragraph 2, right?
Sure.
But you can spend that time practicing flashcards or practicing question sets or asking questions of the crew members, or there's a lot of things that you can do to make good use of that time where you're already at. So that's one of those planning aspects that really comes into play, that yes, it is very challenging to work a full-time career, let alone multiple jobs, but you can do it. But talk to some of the people that have done it, right? And they can help you do that.
So I have a question on the instructor side. So it's a redundant question, obviously, or rhetorical, but the state a couple years ago now has changed the standards that says that if you're a 36, if you're a 120, you're a 240, you're a fire inspector, you're an investigator, what have you, now if you're an instructor, you can teach to that level. So a lot of questions I get from possible candidates and possible instructor candidates for us is that, hey, I've been a basic for 50 years. I just got my instructor card. Can UH hire me and I'll teach? So what is our criteria for hiring instructors, and what's holding us above the bar? Would we take just anybody because they're an instructor?
So accreditation also plays into this, because even though the state says you can be an EMS instructor, doesn't mean that you can lead a paramedic program, for example, right? So technically on paper to lead a program, you have to have a degree. Now, does a degree make you any better instructor? No, I don't think that it does, right? But there are some additional qualifications that have to be measured. My opinion, and it's a very unpopular opinion, is that if you're going to teach and lead a paramedic program, you need to be able to pass national registry.
Yeah.
at least once, right? I'm not saying you have to take it every year, but that requirement kind of removed from the EMSI background. And that's the opinion I take on the matter. Now, that doesn't mean that you can't come in and you can't be a very capable skills instructor. That doesn't mean that there aren't instructors in place that have been instructors but haven't taken National Registry in 15 years. But the difference in those providers are they've been doing that for a long time. They've been instructing. They've been having successful student outcomes, right? And that's the measure of it. Really, at the end of the day, I think it comes down to student outcomes. When you start getting an instructor in an environment, right, you either see the students are doing really well, they're not. And we do have to evaluate that on a continual basis. And if we're not getting positive outcomes, then we have to look at that individual. So we're not taking a blanket, as much as I'd like to say go take National Registry before you teach, right? We're not taking a blanket statement on a requirement because everybody's an individual, just like every student's an individual, but a lot plays on the student's success.
One thing about that real quick that just brings back a prior point that even with the instructors that we might hire, because there's been question about it recently, remember that everybody knows everybody, and that goes back to another point that we're always interviewing. Sure. So we wouldn't just pick somebody because they applied. We've probably already known them. You've already known them. You've already known them, and so their whole career they've been interviewing for that spot anyways. So it's just
in some respect, yes.
Your career path follows you through the entire career, even if you're at one department for your entire career. You're still building reputations and building all of that. And that leads you everywhere.
Your quality, your integrity, your all of that follows you.
And before we hit the test, I have one point on that too. That falls back in a lot of the changes that were done by the state. I'll take COAMPS out of it for a moment. That has fallen on the program director.
Yes.
So the program director, if you hold 10 cards, let's just use fire inspector for an example, or an EMT card, and they want to come to the program director and be like, hey, I would love to teach a fire inspector class or an EMT class. That falls on the program director to be honest now, to say, I don't think this is right, or I would prefer this individual. And that you're going to have some tough conversations because, yes, we all get along. Yes, we all know each other, but that doesn't necessarily mean you're best suited for that position, whether it be EMT, fire inspector, or whatever class you're going to teach. And you have to measure it. I agree 100%. You have to measure it. So you have to see, and we're looking at this in our programs. So when we give a test, and if you taught this subject and the entire class failed that test or did not do good on that subject, okay, I want to go back and then revisit that with that instructor. What are we doing, right? And it's not saying that person is a bad person by any means, but I'm very honest. There's certain things I have, probably 6 or 8 things that I know hands down I could teach very, very well.
To your point, I'm a fire safety inspector.
I wouldn't want to teach that class.
But I'm also a fire service instructor. I can't teach that class. I would never teach that class.
I'm a fire service instructor. I should not go teach any firemen anything.
I would never attempt
and I know,
to
blending it a little bit with EMS classes, but to your point, though, that could flip and just be an EMT class right there. And then as a program director has that
it could be a couple-fold. It could be to Scott's point. Maybe I'm not just hitting the needs of that particular group, right? When I was just doing 3 EMT classes at the same time, right? And the way I would present to one group was not the same way I would present to the other 2 groups. And so if you can't flip that switch, so maybe it's not even the knowledge of the information, maybe it's not sitting down with that instructor and saying, have you thought about not reading the PowerPoints and doing something a little bit different,
and I think and I don't want to turn this into an instructor conversation, but that is that's what sets a good instructor apart from an exceptional, whichever way you want to play that, right? What sets instructor is their ability to read and maneuver within whatever class space they're in.
Well, here's how I look at it. We were talking about in the good old days, we taught cause and effect medicine, right? And now we're teaching clinical judgment, right? Same thing happens with an instructor. Some of the instructors that were taught cause and effect medicine can teach in a cause and effect manner, and others can teach in a clinical judgment environment. And that doesn't even mean that instructor can't apply the clinical and judgment. It's just 2 ways of education, right?
Sure.